And what really drives me is really how can we use technology to improve quality of care, patient safety, access to care, reduce cost of care, and how do we optimize and democratize access to a well-qualified workforce globally. I am the past chairman of the board of HIMSS. I currently serve as a senior advisor for the Albright Stonebridge Group. And I previously was in Abu Dhabi with Cleveland Clinic, and I was the first physician to join the project, and we led it from a blueprint to a fully functioning, fully digital hospital in the Middle East. So that's a little bit about myself. Over to you, Alek.
Yeah, thank you so much, Manish. And coming back to the Middle East, so I'm going across the globe and I'm trying to bring in the global perspective and the vision towards the healthcare and wellness. So coming back to the Middle East, we have today Joby Lal, who is the CEO of one of the largest chain of healthcare service provider, which is Astra Group. So Joby Lal, can you share what you have been doing in the past and how do you see current situation in the overall Gulf region, right? So introduce yourself to the group and then we'll talk as we go along.
Hello, everyone. It's my absolute pleasure to be part of this panel, sharing my experience from this part of the world. My name is Joby Lal. I am heading the retail division of Aster DM Healthcare. It's a chain of pharmacies, optics, and wellness stores. And also, I've been associated with the group for the last 15 years, and I have had the privilege of managing our network of clinics as well. So during this testing time of COVID, I had the privilege or I had the responsibility of managing 70 plus ambulatory clinics along with 200 odd retail units. So as we all know, the last 10 months have been a testing period for all of us. Being a primary healthcare provider or being responsible for the primary healthcare, we have seen a lot of changes and drastic changes happening in a very short period of time. First 3 months, maybe Jan, Feb, and March, what we saw was all, a panic and people flooding to healthcare organization looking for service. And the next 3 months, we saw that all clinics and hospitals being, getting deserted, having no patients coming in because people were afraid, and they were not sure, whether to go to a hospital or go to a clinic unless there is a, real emergency. So that's where, I think the need of the technology, what is the role of technology to make the healthcare more accessible for people, and how do you ensure that the continuum of care is ensured? So we have done a lot of work in last 10 months, and again, last 10 months have been a period of revelation and also a lot of insights. And I'm looking forward to share all that, the learnings and knowledge that we gained in over a period of last 10 months and what we are intending to do in next 5 to 10 years with all of you. I look forward to that and happy to be part of this one. Thank you.
Thank you so much indeed. And now we have Madhur Verma out of India. So he has been in the healthcare industry for so long, and he has managed the hospital as well as the large chain of health service providers. So Madhur, can you share what you have been doing in the past, and how do you see the current challenges, which has really affected the overall across the board? So introducing yourself for the benefit of the listeners, and then also talking about what are the current issues which you're going through.
Hi, sure. Thank you so much for having me.
Switch on your video for a moment.
So I have been a healthcare professional for the last about 20 years, and I've always been involved in healthcare delivery and partly with PE firms in trying to evaluate various healthcare deals that have happened in India, Southeast Asia, and Africa. I've done primary care, secondary care, tertiary care, and quaternary care across geographies in India, Southeast Asia, and Africa. The current challenge that we see in the last 10 months, as I always say, constraints usually are the are that's a place where people accept new technology, new changes, and are happy to go forward and move. In India, especially, teleconsults and video consults were something unheard of before COVID, and all of a sudden that became the norm of life for most of the hospitals for their OPDs to run. Uh, Similarly, India being very disorganized in terms of data and standardization in healthcare as yet, has seen many multifold increases in efforts to be standardized and more be proactive to data reconciliation rather than just let it be in time to take care of it. So I think in the last 10 months or 11 months, what I have seen in Indian healthcare is that the acceptability of technology, the need for information to be standardized has become more evident and acceptable. And as recently as 2 weeks ago, IRDA, which is the regulatory government body to control insurance in India, is contemplating an entire document on which the Indian healthcare information will be gathered and stored and transmitted. So I think this is very, very exciting time for everybody in healthcare across the globe.
Thank you so much, Madhur. And last but not the least, as the moderator of the panel, my name is Alek Verma, and I am the only in the technology field, which I have been doing for last couple of decades. And I have worked with Oracle through and through, and in the different parts of the world. So starting in the Middle East, out of Dubai, then moving away from Dubai to Australia and Sydney, and then came to Oracle headquarters in the Redwood Shores, California. And I have been, managing, driving, building applications for various industries. And healthcare is yet another leading sector which we did in the past so many years. Just the last year, I came out of Oracle and intrigued and challenged by all these, issues. We thought that emerging technologies such as artificial intelligence, which provides us predictive, prescriptive, and sometimes guided intelligence across healthcare service providers, whether it's a clinician or let's say the first responders or the service providers within the hospital. I saw that could be the area which can help. So we came out with the complete robust platform as Centric, which captures data, processes, analyzes, and then provides the guidance to the whole ecosystem of healthcare service providers and wellness programs. So I will be adding some of the nuances of technology, and I will open these questions and we'll discuss that how do we see in the US first the healthcare readiness. So I'll be coming to Manish to understand, are we really changing, adopting newer technologies? Because we are now locked down and we are restricted in terms of the movement, and we are guided that you stay home, stay put, and take extra care to eliminate or to protect due to COVID. So how do you see that the health first responders or the health clinicians, healthcare service providers across the ecosystem should be really looking at in terms of adopting the technologies or helping the patients, helping the doctors, helping all of them? And what do you see, Manish? Because you have been, in the mix of many, many things which you have been doing. So tell us more about that.
Sure. Thank you, Alak. So I'll probably begin by saying that every system is perfectly designed to achieve the results it does. And working in the US and working globally, nobody has truly solved the complex challenge of healthcare. We spend about 10% of the global GDP on healthcare, and about 30%, according to some estimates, is wasted. And from my vantage point, the barriers to transforming healthcare are not technology. There are thinking and thought process. And one of the things that COVID has taught us is good policies, responsive policies, and a willingness to pay for services which are going to bring benefit have a huge influence on provider behavior. So let's look at telehealth and COVID. We've been talking about telehealth for many years, and the adoption has been very incremental. All of a sudden, when we were contained and confined during lockdowns, and patients were not able to get to doctors, and doctors were not able to see patients, and also revenues in many hospitals and clinics plummeted, there was no other way for us to keep healthcare moving forward. And what happened here in the US and India, other places, all these governments and regulatory bodies started supporting telehealth and passed regulations and started paying for televisits. And look what happened to the adoption curve. So my delight or I should say, the silver lining in this tragic situation, and the silver for me is the opportunity that I see ahead. I think we've moved into a framework where people recognize that we are in an era of digitally distributed healthcare and digitally distributed education, right? Where geographies don't really matter to the extent we feared it would. So it's our fear and our thought process that was confining and containing us until before COVID. And I believe that the future involves a lot of exciting potential in how we think about building healthcare ecosystems. So look at a country like India, or look at Africa or South America. Should the conversation amongst policymakers now be, let's build more hospital beds? Or should the conversation be, let's build an ecosystem that leverages virtual care, primary care, and hospital care for the most complex patients? And guess what? When you look at data, that's the safest way to provide care. That's the most patient-centric way to provide care. And that is the most cost-effective way to provide care. I like to use the airline analogy quite frequently. So I was in a discussion not too long ago, and the question came on, this was pre-COVID, question came up, how remarkable is it that in the airline industry, costs have been shifted to the consumer while at the same time empowering the consumer? So 20 years ago, we used to call a travel agent and book our ticket. And now nobody thinks of calling a travel agent. We'd rather go to the portal and book the ticket ourselves because that's just a much better, much more empowering experience. Airlines have gone to the next step, at least in the US, where we actually check in ourselves when we tag our own bags, right? So from a business perspective, labor costs have been shifted. From a consumer-centric perspective, consumer has more control. And I think we need to think in healthcare along those lines. How do we leverage technology to create new paradigms of care? And in that executive conversation, the thinking was, well, patients will not be able to do so. And that's the first stumbling block. The other thing, final point I'll make is that the age-old wisdom was elderly people will not be able to use video chat and other technologies. And what COVID has taught us, we were wrong. So let's give patients more credit. Let's bring them in the center of the equation. And who's the patient? Patient is you, me, and our family, all of us. So those of us, I would say, who are working in the healthcare and the health technology space, we have an enormous privilege to design a healthcare ecosystem that's going to serve us and our families. Which other industry gives you that privilege? We have the problems in front of us. And I can give you numerous examples, but I'll stop there.
So Manish, well said, because you touched upon a couple of points here, and then you mentioned about embracing technology in terms of the digital era. You also talked about creating awareness among the patients and patients service provider, first responders, how they can embrace the digital world. The combination of the physical and the digital, which has to go hands in gloves. So you were talking about how the patients should be able to collaborate on self-service, where they should be able to communicate, collaborate for any kind of service which they are looking for, either the physical health check, or they wanted to have the lab scheduling, or to get any of the service available on the software platform, and how seamlessly we can provide on their mobile devices. So you also touched upon that we were wrong that the seniors or the elderly people are not able to get onto the smart device and do that, but COVID has proven that they are able to go and do everything self-serve on their smart devices. So now we are seeing the transformation already in the US, where we are able to do everything ourselves, staying at home, checking with the doctors with the remote, telehealth guidance. We are also able to schedule all of this. And fortunately, Centric, we are touching on these areas. So we are Centric, very healthcare service provider centric, where we are able to provide communication collaborative platform by which this can be done very seamlessly for anybody staying at home. Very good point. I'll be coming back to you, Manish, on several other areas which we'll be talking about. But coming to Jobilal, in the Middle East region, so Gulf has been evolving rapidly, and I have seen the last couple of years, they are state of the art in terms of facilities at the hospitals or clinics or the labs, right? You have the modern equipment and facilities. And also, I have seen the netizen. People are using the internet or the smart devices. How do you see that during this time they have changed and transformed? What kind of platform and services they are also embracing so that these services could be rendered seamlessly? You are also managing the chain of pharmacy. Now I am seeing here in Jovilal that all my medicines are either informed before that your medicine's refill is ready. You can come and pick it up at the curbside or on the counter. Are you seeing that?
Alek, I'd like to take from where Dr. Manish left. Now, here in Middle East as well, the adoption to the digital space when it comes to healthcare has been very slow. And there were multiple reasons for it. One, from the regulatory perspective, seems that there is a disturbance.
I may request all the people to stay mute if they're not speaking. Thank you so much. Appreciate it.
Right. So this part of the world too, the adoption was quite slow.
Alek, can you mute everyone, please, from your side?
I'm just checking in. While you continue, Jobilal,
Yeah.
I'm just trying to mute other.
Thank you.
Right. So, and again, the regulators were also very slow to adopt the new, the advancement in digital healthcare delivery systems like teleconsultation, telemedicine, teleradiology, etc. But last 8 months have been a period of massive transformation in this part of the world too. Now, the government, regulators, the payers, providers, and most importantly, the end users as well, the patients or the customers, they've also, taken a step forward or many steps forward to adapt to the new possibilities or new opportunities that is thrown up by COVID. Now, to cite some example, at some point in time, now say way back in 2019 December, we had 0 customers or no one was using teleconsultation. But in April, that rose to almost 10% of the total outpatient consultation was happening through teleconsultation. So that kind of a jump happened in a short period of time. Now, the similar changes were happening in the retail pharmacies setting as well. Now, people were adopting to e-pharmacy much more than before. Now, the e-commerce picked up. I mean, the business grew by almost 3 times in maybe during this period in comparison with the same period last year. So at some point in time, even people thought that although unlike Western world, this part of the world, every 100 meters you will see a pharmacy, but still, and there was no need for people to adopt to e-pharmacy offering. But last 6-7 months, we have seen a complete change in consumer behavior. They prefer to stay safe at home or in their own sort of comfort, and they wanted to adopt technology to avail the medicine and the related services as well. Now coming back to the question of what we see as the role of technology. Now as far as I am concerned, now what we all do is not just, I mean, what we do is not healthcare. What we do is sick care. The real healthcare is yet to be yet to be addressed to. So from sick care management to healthcare, leveraging the kind of information and knowledge that is given to us by from various data points. So we do get a lot of data, but the problem is that we are not able to convert those data into good decisions, and which would help the healthcare value chain, whether it is payer, provider, or the physician, even the end user. We could enhance the value of every component in the value chain multifold, provided we use the information in the most appropriate manner. And I hope going forward, the technology will be helping us to do that.
Excellent. So what I take away from what you said so far, that people are embracing the digital way of communication, whereby you are transmitting all the information towards delivery, towards scheduling, towards communication. But in terms of pharmacy, if I wanted to really nail down on pharmacy, because you manage 200 pharmacy, Jobilal, which is huge number in terms of retailing the medicines in time and when it is needed. Some of the patients will be also worrying whether I'm able to get the right medication at right time, how should I get it, and what kind of medication is available next door. So what are the proactive measures and proactive steps you are taking? What I can see that from Centric standpoint, what we are looking at, managing the patients across the board, right? And you do have the data of all your patients who are on the regular medications, who are reactive medications, who are needing something. How proactively that can be communicated that this medicine is available at this outlet within the next 5 minutes of your distance. That is the what importance you'll be able to provide to the patient. And I hope the technology should be able to give you that. Today, we are to provide that by simply providing proactive communication on their smart devices. And I'm seeing these steps here in the US. The chain of pharmacy, CVS Pharmacy, is doing proactively. So those are the areas which we can bring to the bear for your deployment, whereby proactively looking by information of patient, what medication is required periodically, every week, every month, and what refill is due, we should be able to streamline that operation. That is the first step. Then we go on to the data enrichment, how communication could be done through patient information, which you are just alluded about that. So coming back to India again, and Madhur, since you have seen the evolution of technology and you have seen also processes automation. So when we talk about some of the processes in the hospitals and clinics management, so the front office, which requires to schedule the patient, emergency requires to deal with emergency patients, then requires to have surgical staff or surgical technicians, all of that, how are they getting into communication, collaboration, and basically well orchestrated effort to offer seamless experience to the patient, because at the end of the day we are not only curing the patient, but we are also giving in time, on time, that services which delights the patient. Madhur?
So, Anak, sadly in India, even the large-scale corporate healthcare providers do not have good ERP systems in place, which provides them end-to-end service. Most of the healthcare providers chose ERPs based on their financial accounting needs more than the need of the patient or the medical records. In the last 7 or 8 years, we have seen many of these healthcare chains adopt better technology and get more healthcare into the ERP. So this is something which is growing, but this is only something that I'm talking about, which is in the large healthcare chain. As you would know, more than 80% of healthcare in India is still provided by the mom and the pop shows in urban, metropolitan, semi-urban, and rural areas. So the flow of information is still very, very limited and is limited to what can be related to billing and accounting services only. Predictive healthcare informatics is something that people have dabbled with in healthcare. And given that most insurance in corporates is governed by corporates that are trying to cover their own employees, there's a large uptake from them to ensure that they get predictive information on what the future health of their employees would look like. And this is something which I call as a green shoot, which will gather steam going forward.
So this is one point which you are alluding now on predictive, prescriptive, right? And that is where technology efforts are going in very strong. And I'm coming back to Manish again, right? Because Manish, you and I are living in the world where a lot of research is going on into artificial intelligence, more towards machine learning, more towards data mining, and more towards, giving some robotic, right? Robotic intelligence, what we call soft bot intelligence, so that we should be able to provide all that in the patient, the doctors, the surgeons, or first responders. Before they could respond, we have the information available and on their smart devices, on their monitors, so that we don't want to give it to a chance on the humans. Like, I'm not confident on the cockpit pilots. As long as autopilot is running, we are confident that plane is going to land. But the moment human errors, you have some issues and challenges there. So how do you see in the healthcare also artificial intelligence coming in to enrich, empower the doctors, clinician, so that they are given 95% and above guidance? Do this, do this, do this. If you find anomaly, then they should correct it. So I'm hoping that healthcare would be embracing this AI as well. How do you see that happening in the state of the art healthcare service era?
So thank you, Alek. So I'll sort of reframe the question. I think the promise of technology ultimately is to strengthen the relationship between the doctor and the patient, and to democratize access and provide context-specific insights for better decision making. In today's world, we have a lot of data we are generating. In fact, I would call it a data tsunami that's upon us. When you're looking at data that's generated and available to a physician at the point of care, whether it's in the US, whether it's in the Middle East, Europe, or Asia, doctors and nurses are seeing more and more and more data when they are caring for the patient. And the solution is really not to give doctors and nurses and patients more data. The solution really lies in the elegant art of enabling better decision making through insights that are contextualized. So I can give you a number of examples. So let me start with one. In the intensive care unit, I'm sure many of you have had an opportunity to walk through an intensive care unit. And what do you hear? Constant beeps, right? How does the nurse decide which beep is more important than the other? There's really no way of knowing so. And you know, the device manufacturers create alert system because that's what they're supposed to do. If something is out of threshold, a warning should be set up. But when you have a unit which has lots of devices, there's no way. So that's one example where we need to start thinking about patient status and how do we actually combine all the signals and deliver an actionable insight to the nurse or the doctor that this patient is declining in his status or this patient does not need attention. That becomes meaningful. And when we talk about bringing the joy of taking care of patient, that's what it looks like. Where I am not engaged with thinking about how to organize data and how to look for data, we're still spending a lot of time looking for data. In fact, I would say the problem in some ways worse because, you know, in the paper world, stuff used to be hidden away and we never used to see it. In the EMR world, we have a lot of data in front of us, but we don't have the time or the capacity to do so. So I think the first step that AI and other tools can help is really synthesizing the data, the low-hanging fruit. The question I often get is, well, will the AI replace the doctor? And I said never, because healthcare is a human endeavor. And what's lacking in healthcare right now is health and care. And if we can automate some of the low-hanging tasks, and we can simplify the process of care delivery for physicians by giving them better insights for decision making, I think that's a step in the right direction. Similarly for patients. Patients are not empowered at all. We have a very paternalistic healthcare system globally. Secondly, they don't have the information to make better choices. A patient lives with his body or her body 24 hours a day, 7 days a week. And with the power of smart devices that have an ability to bring in multiple data streams and combine them to help me make a better choice when I'm about to eat a meal. So if I'm a diabetic and I need to understand, you know, what I should eat, what do patients do currently? Somebody has given them a meal plan which says you have 20 grams of carbs and you have this and this, right? I can't translate that into an actionable insight, but imagine if I'm able to take a picture of my plate and somehow that translates into what I should eat, right? That's empowerment. So, and I know that there are isolated solutions. The challenge in healthcare is solutions are not integrated. And the thing that I think we really need to strive towards, let's focus the conversation away from technology. Let's talk about the problems we're trying to solve. And ultimately, the true sign of success in technology is when technology becomes invisible. So when you look at the consumer space, right, and I won't name specific vendors, but these devices are a joy to interact with. You know, many of these companies, they look at solving problems which we have not even thought about. I do not think many vendors are doing so in healthcare as yet. And I think this is a cultural shift that needs to be enabled, where we are now focusing our attention on how do you simplify a doctor's life, a nurse's life, how do you empower the patient, and how do you integrate technology. So my thinking is that we have a lot of work to do in especially developing economies around data standards, around health information exchanges, around streamlining regulations and policies. The truly successful health system will be that enables and empowers the frontline stakeholders and the executives for better decision making by, you know, taking care of the building blocks and then bringing intelligent, intuitive technologies that actually are invisible, but they actually enrich in our lives.
Excellent point. You know, the point on the data regulations, some kind of you know, data governance, and how much data can be shared, how much data can be synthesized, how much data can be processed, and how much data can be mined to provide that intelligence which you are talking about, right? Predictive insights. Now, you know the power on data analytics, and we have now got the scale on the cloud to process, synthesize, and give you predictive guidance, right? But how much is available? That is one point which you talked about, integrated data repository and the single source of truth regarding the patient. If it is centralized, and we know that in the US it has been centralized because some of the hospitals, they are having unified patient ID by which any service providers will be able to access the patient information, and they do not have to do the entire investigation over and over again, right? So if that effort has gone in, now I'm talking about the peripheral system. The peripheral system which says, you know, patients should be able to access the doctor one-to-one. Patients should be able to access the labs one-to-one and communicate, collaborate, and get everything on their smart devices. That's the area can be done very easily. What we say operational efficiency. And we can also empower the patient to have their self-service to get these things done, which is coming to the corporate wellness. Now, when I'm talking about corporate wellness, such as Oracle employees, IBM, Accenture, or any major corporation employees, they need to be healthy. They need to have periodic and proactive health check monitoring, and most of these people are paid by covered by insurance. So why they are not taking care of the health? That is the area we are getting into. So healthcare, wellness. If we do proactive, I think we are solving some of the problem beforehand, before any major thing happens, right? So we'll talk about that in terms of corporate wellness, social wellness, avoiding or eliminating some of things which might occur due to stress caused by this fear, right? So we will be talking about that, Manish. So coming back to Jobilal, now he is talking about data governance, and we are talking about Middle East in terms of data regulation, looking at predictive processing of those, giving insights to your patients community, as well as your service providers, how working together as an ecosystem. What are efforts we can participate with? You know that Centric is involved in data science. We are providing predictive guidance based on data intelligence. We are automating certain processes. We are not touching inside the clinics or hospitals, but we do touch the external peripheral system, which is getting transformed into digital transformation.
Alek, if you ask me, and as we heard from Madhur a while ago, now here even in this part of the world too, although hospitals run on good HIS system and that an EMR, which is able to capture the patient data information and the details in an efficient way. When it comes to decision making, when it comes to using that insight information to empower the patient to take better lifestyle decisions and lead a healthy lifestyle, that's been always, there's a gap always. So I don't think the region has matured to the level that we see in the Western world, in my opinion. In last 5-6 last couple of years, yes, there has been many initiatives in that direction, but I see a huge gap in using or converting the data or information available to empower patient to take better decision, and also to empower the service providers or healthcare workers in a better way. So I believe that gap is very, very important to be. This is a very important areas to be addressed. Without having that particular, that issue addressed, I don't think we are in a position to achieve the kind of transforming from sick care to health care. So that can happen only with that kind of an empowerment happening across the board. So there is a gap, and without that gap is very evident, especially during this period. And another area that I would like to highlight is that many times we pay a lot of attention and focus on the customer or patient, and we tend to ignore the people who actually deliver the service or care to the patient or the customer. So many times, so they are also kind of blindfolded. So they do have, they approach the patient without having any much visibility or in-depth understanding, especially from a retail point of view. Many times when a customer stand in front of you, you do not have any much knowledge, understanding or visibility into the unique behavior of that customer, unique requirement of that customer and his past history and so on. And many times we have, our approach is quite reactive. Now, how do we address this? How do we use technology to empower the frontline workers? If it's a nurse, if it's a pharmacist, a physician, how do we empower the frontline workers? Now, if I take a step back, we heard airline industry as an example multiple times. Now, another challenge, if you look at airports, many times when you land in an airport, you end up getting into a long queue at immigration. Now, unlike any other industry, in airline industry, gives you exact information on how many flights land, how many passengers are going to come out, and how many immigration officers are required to be there to ensure that there is a smooth flow of passenger in. Now, healthcare industry is also not any different. Many times the resource utilization, effective utilization of resources doesn't happen because the real understanding of, we are not able to predict based on past data and past behavior what would happen next week or next month. And I think that's also a very, very important thing, especially when we are facing a resource crunch, going through a period where a resource is becoming extremely challenging and difficult. I think this is also a very, very important areas to be addressed.
Very important point you highlighted about mapping the behavior of the whole ecosystem, like patient, the frontline nurses or the doctors, all of that. And that is where we are focused on developing the behavioral pattern score. So if you, many areas have been, we have paid attention towards, like customer net promoter score. Why can't also we look at patient behavioral pattern score? What basically triggers this act of behavior and how that can be also, acted upon or alerted to the service provider. So many areas which you have touched upon is doable, and that is the area of development we are working at Centric. So Centric has come with very centralized customer or patient behavior score, which determines based on indications, based on the past history, and based on all the information coming in from various data channels. So Jobilal, as you mentioned, if we empower you as a healthcare service provider or pharmacy network, or let's say clinics, we will be working on the central patient repository, the data. That data, you have it. If we can get access to the data, we should be able to proactively give you some intelligence in terms of not only the past history, the behavioral, their clinical evidences, all of those that can help the frontline service provider when that patient should be proactively approached. That is the difference between reactive to proactive. And also on the wellness program is the new thing which is coming together to eliminate some kind of emergency visit. Right? So we should be looking and working together, and given the opportunity, I see great opportunity to solve this problem. So coming back to Madhur in, let's say, efforts and initiative. I'm hearing a lot of virtual reality, the image processing, the pattern matching, and also voice to text, text to voice. Those are the innovation happening. What do you think, across the globe, which healthcare should be embracing now due to COVID, and then this should be rolled out as we go along?
So Alek, I think I agree with Dr. Kohli, as he said. We are missing both the health and the care. And if you look at other industries and what they've done to empower customers, it's not only airlines that, for example, he mentioned, but let's look at hospitality. The CRM softwares are strong enough in hospitality to give you a fantastic pattern of behavior as far as customers concerned. The same is true with most of the uh, online platforms that are available on e-commerce today that give you a great pattern of behavior as far as the customer is concerned. So I think from a healthcare perspective, if we can pick and choose what are the right things that each industry has done to empower the customer and therefore empower, and by customer both the healthcare professional as well as the patient and the family both put together, I think that would be a good direction to set on. Because eventually, at the end of the day, the ecosystem does not benefit if only the healthcare professional or the patient is taken care of. It has to embody both the needs and the wants of both these counterparties and therefore develop together.
Excellent. All right, so we are 8 minutes away from the top of the hour. So now I'll go back to Dr. Piyush Sinha, who is a researcher, professor from IIM Ahmedabad, and he has been involved in so many healthcare initiatives. And I'll request him to turn on his video and also unmute so that we can listen to him and maybe throw some light after listening to all these panelists. What do you see, Dr. Sinha? Because you have been mentoring and guiding us in terms of centricity of the patient, right? How we should take care of patient through the ecosystem of healthcare service provider.
Alek, thank you very much for having me on this panel. And it's nice to have the panel members here. And I can also see some very good names in the list of people who are attending this event. First of all, I think that there are a few things which I have understood from this particular working in this particular sector, and the genesis of many of the things that we do possibly would be stemming from that. So I thought I'll just bring that out, and then we'll get into how we actually look at solving the problem that you are looking at. One thing which I found, and as it was mentioned earlier, that the patient centricity that we are talking about, or we need to learn a lot from what other industries have done. But one thing that I think this industry has as a character is what I call as power distance between the consumer and the provider. In my opinion, healthcare is an area where this is the maximum. Provider and the consumer, the gap in information asymmetry between the doctor or the healthcare professional and the consumer, the patient or even the caretaker, is very, very high. The result of that, and it is research show that wherever power distance is high, there is a deficit of trust between the two. That's something which is there, and this is basic human behavior. That's something which I understood in this particular sector. So the first thing that I, as a consumer, as a patient or consumer, look for is that can somebody instill trust on me? That's the first thing. That's the first thing that I would look at. Whatever we do, whether it is through provision of technology, provision of what you call care, provision of support services, right? The way I'm being handled, all that is something which is that's one point. Second point, which I think Joby brought it out very well, is that there is data and there is information, but do we have the knowledge? That's the second point, which I'm hearing. That data is there. So first of all, start with many people don't even have data about what is happening around. Now it's changing a little bit, but still most of the hospital may not have the data. Although the fact of the matter is data is being captured somewhere, but how many of them are capturing electronically is a question that needs to be asked. That's something which is there. But all those people who have captured the data, what is that we do with that data is a question that we need to be asking. And as Joby brought this up, the person who is rendering the service, am I empowering that person? That's a question that we need to be asking. Again, I'm focusing. I think I have no authority to talk about the clinical side of it, but I'm only talking on the non-clinical side of it. And with the kind of requirement, the healthcare requirement which is happening, it is necessary that the interaction between the doctor, with the healthcare provider, and the patient or the customer needs to be on a continuous basis, especially with the rise of, I'm particularly talking about Indian context, the rise of the lifestyle disease, where you need continuous guidance from the customers, from the doctor, and somebody who can help. That's something which is very important. So in all this, essentially what we are saying that if I need to be, first of all, I got to be patient centric. Let's again, we're saying when you are patient centric, it is not saying that the patient would ever know more than the doctor as such, but the provider of the service, therefore it becomes a moral responsibility of the provider that because of the power distance, I need to walk that extra mile to ensure that I make people comfortable. That's something which is there, and therefore the data which is being put up, right, being thrown or being collected. How do I use that data? First of all, and collect that data. Second, use that data and bring in meaningful interventions almost on a continuous basis, on a regular basis with my customers, so that the relationship between the doctor and the patient is something which becomes very fruitful. In fact, there was a study that one of the PhD that I work which was happening as part of the PhD. I was the examiner for that. That's how I came to know. And we did a study as to what are the 10 things, top 10 factors, which if we were to make the business more interesting for people, and it came out from that study as well as one of the workshops that I was doing with some of the doctors as to what is it that we do. So because we were in this workshop, we were talking to people, doctors who are already very successful. So they have already had reached to a level after which it was not the revenue which excited them. And that's why they were, one thing which I was hearing that they were stagnating. These are basically pediatricians who are practicing, not in the hospital, but independent practitioners. They have their own clinics. And they said, we don't want to become a hospital because the moment I become a hospital, I have to move from being a doctor to being an administrator, which I don't want to take the role. So therefore, what came out is that they were finding themselves in a rut because they were doing the same thing again and again. So I asked them, what is it that, so there are two things that they said. Scaling up, I cannot do because I can't go vertical. I don't want to go vertical. Not that we can't, but I can't go vertical. Therefore, which means that I can't increase the number of patients that I want because I want a particular kind of life, which beyond which it will change that. So when we discuss a little later, what came out very clearly that the only way that they could get excited if they could do something innovative every 6 months, let's say, if not every quarter, every 6 months. And the innovation, the genesis of innovation would be how well do they know the patient and the pattern, and based on what intervention. So the point that all of us are saying is that there is technology available. And for that matter, for whatever reason, the healthcare is still lagging behind in terms of customer interfaces. That's something which is there. So there are miles to be traveled.
Yeah.
And that is where we have to work together to make sure that the connect between the healthcare provider and the patient is not seen as the power distance. Can I reduce that feeling of that power distance? Can we reduce the feeling of asymmetry? That, in my opinion, would be, if you ask me, is a single goal if you could set using information, data, and technology. Alek.
Excellent insights, Dr. Sinha. I'm so proud to have you in this, which you have transpired many viewers. Now, I may go to Dr. Shalini Malhotra, and she has also joined this group, this team, to share her insights. She is a practitioner from OBGYN, and she is a practicing doctor at Al Qasimi Hospital in Sharjah. And Dr. Shalini, if you can turn on your video and if you can also unmute yourself. I know I'm overshooting the time, but I may like to request others just few minutes more. Shalini, if you can hear me, and if you mind sharing your thoughts.
Hello to everyone.
Yes,
yes, I can hear you very well.
Yes,
it's
good.
a pleasure to be on this platform with all of you. Of course, extremely enlightening talks by each one of you and a very different perspective, which we healthcare professionals don't really see much. What's really been a big change for us is me working in the Ministry of Health and Prevention. We haven't really had any reductions in the COVID times. We've actually been, we've had a bed occupancy 4 times than we ever had. And this is not only COVID patients, we even had general patients. So therefore, the first point that I heard one of the speakers say was that the hospitals were the basis for converting to telemedicine was that there were no patients in the hospital or that the patients were fearing coming. Well, we didn't see that yet. Yes, we introduced telemedicine into a hospital in a very successful way and at a much faster pace than we ever thought we would. And I think primarily that was only because the need of the hour was to bring less patients into the hospital due to the pandemic. Definitely, I agree with Professor Sinha that there is a big gap between the healthcare professional and the customer, because that's the gap that we are trying to minimize in our organization, trying to understand the mindset of the customer, what he expects, and that's what we're working on. Yes, I think even the other speakers have been very inspiring, when they say that if there could be technology that could benefit a healthcare professional, make life easy, it's definitely much needed. For example, now I'm a robotic surgeon, and therefore when you use the robot, you realize that the Da Vinci robot is such an invention which improves the life of a surgeon, of course, of the patient as well. So we're the only organization in the Middle East which has done over 130 gynecology robotic surgery cases. So that's where you realize the technology is really needed to change the face of healthcare. And therefore, yes, each one of you and your contribution is really, really much appreciated.
Shalini, thank you so much. I look forward to engaging and working with you. As you know that we are, dedicating our resources to build some innovative platform and services, leveraging this robotic process automation, artificial intelligence, and also streamlining some of the processes which can, smoothen the patient and service provider engagement. Communication, collaboration, engagement offers delight. That is where we are working towards. And just one more, I would like to invite Rajan Chaddak from IBM, and he has joined in the meeting. I may request him also because he looks at IBM healthcare And Rajan, you may, Oracle and IBM has always led the initiative towards healthcare. And I have learned a lot from Oracle last 2 decades. And now I'm translating that in building the platform. So Rajan, can you also share just in few minutes before we go and wrap up the meeting, so what IBM is doing, how you see it, and what you transpire others?
Yeah.
If you can turn on your video, Rajan.
You want me on video, Alek?
If
I
you
wasn't.
can, so that people will know you as well.
Okay, I'll switch it on, though I'm not in a presentable this thing, but still. All right. Can you guys see me?
Very nice. Very nice. Absolutely, Rajan. Yeah, go ahead.
All right. Thanks. Thanks for the introduction, Alek. But I am here in capacity to hear to this esteemed panel and to learn. That was my motive and my like inspiration for joining this call. And it wasn't definitely not to sell IBM or talk about IBM. So whatever I would talk would be as in my personal capacity and my personal opinion.
Absolutely sure.
I just wanted to set this right. So because this is not where I'm trying to sell IBM services or IBM at all. Like and I would like to like tend to agree with what panelists said, but at the same time, yes, as I think Dr. Manish pointed out, that technology is there and more than mindset, I thought this is a culture shift for people to use technology. So different cultures see technology differently. So if like we said, like people who are old but still they have absorbed this technology to do the telemedicine or video consults, etc., which may be partially correct, and but as per the culture, what I've seen here, people are more comfortable when they physically go and see the physician, because healthcare is all about the connect between the patient and the physician. So if a physician is working with a particular hospital and physician changes the hospital, I have seen the patients also changing their hospitals along with that physician. But having said that, I feel technology plays a very big role to assist and to augment all these healthcare providers to keep us more healthy, to keep us lively, to give us maybe a better and a longer life. And as I think Dr. Shalini pointed out, this technology is the one which is helping them. And with AI, where the system keeps on ingesting a lot of data and bringing out the insights, which helps the physician to take a much more educated decision within no time, while the patient is there in front of the physician interacting. So this is where I see technology going, and I think that's how, and especially in this region where like in UAE, the technology has really like surpassed everything, and I don't see any hospital which won't have all these the best of EMRs and the best of ERPs and the niche technologies which are all integrated. Like Dr. Manish said, he worked for CCAD for a while here, and I had this opportunity of interacting with Dr. Manish for a long time, because IBM was giving services to CCAD and we still are. So Manish and me worked together a lot on trying to make that reality from blueprint to HIMSS 7 hospital that CCAD is today.
Thank you so much, Rajan. And you shared a great insight here. Embrace technology which can assist and augment not only the sick care, or rather it will transform to the health and well care in terms of our whole healthcare ecosystem. I am proud to say that Centric has launched the healthcare vertical services And I'm also proud to mention that we do have the Middle East regional head, Anil Kumar, has joined on board to lead this initiative in the Middle East based out of Dubai. We do have Harish Chandar, who is based out of Abu Dhabi, who is augmenting and supporting all our initiative towards empowering the ecosystem of healthcare. And we are partnering with many, many vendors like you, Rajan. So I'm really, really glad that you all joined in the meeting today. And I thank our panelists today. I really thank all the members who shared the insights. Shalini, you brought in a lot of on-hand practical insights to the viewers. Jobilal, I really look forward to engaging and working. We see potential to work together. We do see that engagement will bear fruit for all the ecosystem out there, and all the viewers. I will be reaching out as we go along. So thank you for your time. I know we have passed 10 minutes of the scheduled time.